Dr. Eric Osansky, welcome back to Women's Wellness Radio.
Thank you. Thank you so much, Bridget.
Yeah, I want to congratulate you on your new book, Hashimoto's Triggers, Eliminate Your Thyroid Symptoms by Finding and Removing Your Specific Autoimmune Triggers. So this is quite the accomplishment. Let's see here. It's over 500 pages.
Yeah, it's a pretty big book, yeah.
You're a writer, clearly. That's great. And this is such a lovely book. Do you find a lot of practitioners are buying it as well, for the level of detail in this book?
So far, I think so. Honestly, I haven't surveyed to see but I've had a number of practitioners purchase it and tell me they purchased it. And a few have mentioned that they're going to put it in their practice.
Nice.
So yeah.
Yeah. So you talk, and a lot of patients too are pretty knowledgeable now. They have Hashimoto's, and they're thinking about, they're learning from podcasts like this, or they're going to your website. So they're pretty knowledgeable. So I think even for anybody, this level of detail is appreciated because people don't want to just skim the surface, especially if they're not getting better.
Exactly. And I did try to, if you notice, I made it, or at least I think I made it well organized. So even though it's very detailed and, it's great for those who want to read the entire book, people could pick and choose. So if they just want to, focus more on the triggers and, how to find the triggers, removing the triggers, it's very well organized. So they could just go to whatever section they want, or even, if they want to just focus on a few different chapters within a specific section, they could do that quite easily.
Yeah. I kind of wanted to pick and choose a little bit today as well. So you have a number of triggers of Hashimoto's listed. I don't know, it looks like about 15, 16. So just maybe before we should get into them, like what are we talking about when we say triggers of Hashimoto's? What does that mean?
Oh, sure. Well, there's something called the Triad of Autoimmunity. So the Triad of Autoimmunity, also known as the three-legged stool of autoimmunity, that involves genetic predisposition, an environmental trigger, and a leaky gut. So in order for autoimmunity to develop, including a condition such as Hashimoto's, we need not only that genetic predisposition, but that trigger and a leaky gut. We might talk a little bit later more about a leaky gut, but the trigger, it could be probably the best way to describe it. There's different categories of triggers. So typically the four main categories are food, stress, infections, and chemicals. And all of these can trigger an autoimmune response, cause the development of autoantibodies associated with Hashimoto's, or with different autoimmune conditions. Of course, the focus here will be on Hashimoto's, but there are many, many other autoimmune conditions. And, all those autoimmune conditions, whether it's Graves' disease, multiple sclerosis, rheumatoid arthritis, all these have different triggers, so different factors that can lead to the development of autoimmunity.
Okay, great. Thanks for giving that introduction. So I wanted to start with some of the food triggers, and I especially wanted to pick on I like that you said the primary food trigger, you just laid it out there, is gluten. Because I find that some of my clients are definitely off gluten and dairy and sugar all the way, and others are like, well, I can't really tell if it affects me, or that's one I get a lot. Oh, I went off of it and I went back on and I couldn't really tell. Or dairy, kind of similar thing. Well, my symptoms didn't really seem to improve, so I went back to eating dairy. So I would love for you to just dig into those two a little more to just really help lay the groundwork on why these are so important if you do have Hashimoto's.
Yeah, well, gluten, both gluten and dairy, they're common allergens. So that's one reason. Just a lot of people have food sensitivities to gluten and dairy, some just to gluten, some to dairy. But also with gluten, the research has shown a few years ago that gluten causes a leaky gut in everyone. And, I mentioned a few minutes ago about the triad of autoimmunity, where you have that genetic predisposition, that environmental trigger, and a leaky gut. So gluten, could, even if it's not a direct trigger, which I talk about in the book, like direct trigger, leaky gut trigger. So a direct trigger, just could think of like celiac disease. Like celiac disease gluten is the main trigger. And so same thing with Hashimoto's. Gluten can be the main trigger that's triggering the autoimmune response, but it also can cause a leaky gut. And again, it could cause a leaky gut in everybody, even if you don't have any type of sensitivity to gluten, whether it's celiac disease or non-celiac gluten sensitivity. But so again, so gluten, you could be sensitive to gluten. It could cause a leaky gut. Same thing with dairy. You could have a dairy sensitivity. There's also what's called cross reactivity with dairy, as well as with other foods. And what this means is that, even if you're not eating gluten, if you're consuming some dairy products, in some people, not in everybody, but you could produce gliadin or gluten antibodies by consuming dairy. So you could have similar effects. And so inflammation, again, I mentioned a few times leaky gut. And there's, quite frankly, we don't need to eat gluten or consume dairy, although, to be fair, there are some health benefits of dairy. I know people who are, and this is a little bit controversial, some who are able to reintroduce dairy without a problem. There are some people who, when they have a healthy gut, healthy immune system, even choose to reintroduce gluten. But in a perfect world, we probably all should avoid gluten. And probably might be able to say the same with dairy. Again, that there's some gray areas, differences in opinions, but especially when talking about Hashimoto's autoimmunity, a lot of healthcare professionals feel strongly about avoiding gluten, avoiding dairy, for some of the reasons I just mentioned.
Yeah, and you get into some of the details in the book if people need more details about some of the proteins in milk, about pasteurization, which is one of my really big problems with dairy.
Yeah. And homogenization, and exactly.
Yeah. So people can kind of read more if they need to understand that a little bit better. Um, let's move on to estrogen dominance, which I don't think I had really thought of as a trigger for Hashimoto's. And this is a women's health show, and many women are in estrogen dominance, from young women because of stress and making less sex hormones. There's certainly the toxicity and the environment piece, although my population is usually fairly aware of that, which is great. But there's certainly a lot of external estrogens in the environment. And then many of my ladies are perimenopausal, as am I, and that puts you into a situation of estrogen dominance that's pretty hard to avoid. So what's going on with the thyroid connection, and what can we do about it?
Yeah, well, also what I talk about too, it's not just our own, like you mentioned, you're in, perimenopause, and but also what I talk about too is not just the natural estrogens, but xenoestrogens as well. So we got to consider things such as bisphenol A, which is in plastic bottles, and that, I think that's a greater concern, not to minimize our, imbalances of our own hormones, but I think a big concern are the synthetic estrogens, the chemical estrogens out there. So we got to really focus on trying to minimize our exposure, not only to plastic water bottles, but you're probably familiar with this, with thermal paper receipts. Even they have the BPA. Of course, there's other endocrine disruptors as well. But also with as far as natural hormones, I think, I'm not opposed to bioidentical hormones, and I'm not sure if I already forgot if I mentioned this in the book as far as bioidentical hormones, because it's been a few months since I released the book. But again, I think that we need to be careful with, both women and men. I mean, of course, with estrogen, it's more women taking estrogen as well as progesterone, but with there's a time and place, but I think a big focus also has to be not to stray too much from the topic, but also on healthy adrenals. In order to have healthy adrenals, you need to have healthy sex hormones. And then also, it's not just about how much exposure you're getting to estrogens, but whether it's through bioidentical hormones or whether it's due to, again, xenoestrogens, but the detoxification of estrogens, which I talk about in the book. So estrogen metabolism. And that could be an issue with women as well, is it's not necessarily that it's not only the exposure, but they have problems with detoxifying estrogens, with metabolizing estrogens, and that's also a source of estrogen dominance. And a lot you can do through diet, just eating foods such as cruciferous vegetables, broccoli, kale, cauliflower. That might bring up some controversy with the goitrogens, but which is another topic I discussed in the book as well. But again, most people with Hashimoto's, they're fine eating those foods. Maybe if they eat like 5 cups of broccoli per day, maybe it'll be a problem. But most people, as you probably find, it's the opposite problem. They're not eating enough vegetables. Usually, it's not that they're eating too many, but estrogen metabolism is huge, and there's supplements you could take too, like calcium D-glucarate, DIM, but you could do a lot through diet as well. So I think it's a combination of, when talk about tackling estrogen dominance, you want to have healthy adrenals. You want to minimize your exposure to exogenous estrogens. Again, if you're taking bioidentical estrogen, I'm not saying to stop that, but and then also to help with estrogen metabolism.
Okay. Yeah, those are some good tips on supplements and good reminder to just eat your vegetables and that support the liver and detoxification. And we talked a little bit earlier about the gut, and the gut is such an important area for detoxification and elimination as well. So we definitely have to support that.
Mm-hmm.
With the food elimination, there's another thing. Oh, I wanted you to talk briefly about the connection between Sibo and the thyroid as we talk about the gut.
Sure. So SIBO, that's small intestinal bacterial overgrowth, for those who are not familiar with that. And so normally there's most of the bacteria should be in the large intestine. So with SIBO, as the name implies, there's an overgrowth of good bacteria, and that's important to distinguish. It's not a pathogenic infection, but there's too much bacteria in the small intestine. And as I mentioned in the book, SIBO isn't necessarily a direct trigger of Hashimoto's. So it's more of that leaky gut trigger, where if you have too much bacteria in the small intestine, it can cause that increase in intestinal permeability. And and then that's once again one of the factors of the triad of autoimmunity. So that's that in turn can make someone more susceptible to have an autoimmune response. So SIBO itself doesn't seem to be a direct trigger of Hashimoto's. Usually, at least from the research that I've seen, it's usually a combination of factors. So someone, may have SIBO, and then that causes leaky gut. And then they're exposed to a different environmental trigger, to a direct trigger that ends up causing Hashimoto's.
Okay. Yeah, this is really interesting to me. I'm running a little gut program right now with a group, and it's mostly for the large intestine, kind of rebuild the gut. But
Mm-hmm.
I kind of think that most of them have SIBO. So I'm having to really dig into that, because I think that I know I'd love to hear your opinion on this, but some of my colleagues who specialize in SIBO say basically, most bloating, chronic bloating is SIBO. And then another practitioner I worked with was saying, well, the gas produces in SIBO are very toxic to your body to try to have to break down. So I wonder if you can just speak a little bit more to like the mechanisms going on with SIBO and how our body has to react to it.
Sure. Well, with SIBO, there could be different, different mechanisms of SIBO. And one way you mentioned with the thyroid SIBO connection. So low stomach acid is one way where a small intestinal bacterial overgrowth can happen. And with hypothyroidism, it's very common to have hypochlorhydria, which is again low stomach acid. But there's also one of the more common ways is damage to what's called a migrating motor complex, which is the cleansing wave in the small intestine. And that damage, if you don't have that cleansing wave working, then that could lead, and usually does lead, to buildup of bacteria in the small intestine. And there's actually every year there's like a SIBO symposium. You've probably seen this day and age. There's a lot of different summits also, but there's also an annual SIBO symposium, and they present the research, and they're still trying to find a cure for that. But when it's that, because it's when it's the damage to the migrating motor complex, it seems like there's an autoimmune process going on there as well. So there's no permanent cure when that's the case. But like I said, it could also be low stomach acid. Could be something structural like adhesion. So you might need like someone who does visceral manipulation, visceral therapy to break up adhesions. So, that could be a factor. But, as far as the gases being toxic, I mean, typically, we're talking about like methane, hydrogen. I mean, they definitely cause the person not to feel good. I don't know if they're, really, typically with methane, you'll get symptoms like constipation is really a big, where it's the hydrogen more so the diarrhea, although that can fluctuate. And then there's hydrogen sulfide, which that unfortunately can't be measured yet as of doing this podcast. But so when you get a blood test, that's typically looking at methane and hydrogen. And so, and you can have false tests. It's challenging with the Sibo breath test, because I've had people, you mentioned where a lot of people who have bloating have Sibo, and a lot of those people will have positive breath tests, but some of those people have negative breath tests. And then, do those people have Sibo, or is it something else? And, so it sometimes can be challenging because you mentioned a large intestine, like a comprehensive stool panel, isn't going to give us the information we need typically for Sibo. And there's organic acids testing, but that also is not specific for small intestine. So sometimes it can be challenging to diagnose Sibo, but anyway, so yeah, I agree with you. A lot of people do have Sibo. I don't know if you'd say that the majority of people that have bloating have Sibo. If the Sibo experts are saying that, then I can't argue with them because they're the experts and they're the ones seeing it every day. But I will say it is a common problem, and it's challenging to treat because it's just the same antimicrobials that work for other pathogens, like other types of pathogenic. Well, again, Sibo is not pathogenic, but work antimicrobials that you would take for parasites or H. pylori, for example. I mean, there's some overlap where some of them can help with Sibo, but a lot of times Sibo is challenging to get rid of. And as I mentioned, if there is a problem with that migrating motor complex, even once you get rid of it, you're going to need to take something called a prokinetic, which helps with that cleansing wave. Because again, the Sibo will come back if you have that autoimmune process going on. And I do get into a little bit more detail in the book about that.
Yeah, I've never heard of these prokinetics. That's pretty interesting.
Yeah.
Well, I want to ask you a couple more things before I let you go. And the next one I want to ask you is on the blood sugar. So I think blood sugar is an area that doesn't get enough credit. It's like not sexy enough or something. So I'm actually going to skip some of the sexier ones like Lyme disease and mold and iodine, because everyone's always talking about those and arguing. But blood sugar is a big deal, I think, especially for women. I see it to be more of an issue with women. So tell us how blood sugar imbalances can be a trigger of Hashimoto's.
Sure. Well, blood sugar, one of the big ways it increases pro-inflammatory cytokines, which are associated with Hashimoto's. Blood sugar also, leptin, which you probably heard of, involved in appetite regulation, and that can, cause imbalances in leptin, which also can lead to dysregulation of the immune system. Blood sugar, as you said, it's not one of the, when we think of triggers, we tend to think of even the categories I mentioned earlier. I mentioned, food, I mentioned stress, I mentioned chemicals, and I mentioned infections. But blood sugar is one that is overlooked. And when I talk about it in the book, it's, mostly as far as being a trigger, it seems more so, like the hyperglycemia, like insulin resistance, more associated with being a trigger. But of course, that's not to dismiss those who have hypoglycemia, as well. Even though that might not be a trigger, it still is something we of course need to pay attention to. But diet,
body stress, certainly when your blood sugar goes low, and then it can spike afterwards, right?
Yeah, exactly. Yep.
Okay. So what were you gonna say? Sorry about diet.
What was that?
I cut you off. What were you gonna say about diet?
Oh, I was just going to say that obviously with blood sugar, diet plays a big role. But also with insulin resistance, inflammation is huge too. So a lot of people with insulin resistance, which is, again, that's, as the name implies, the body's it has too much insulin, but it becomes resistant to it. And of course, you do want to eat well, eat whole foods, minimize refined foods and sugars, try not to eat too many carbs, eat plenty of healthy fats. But also, a lot of times, you do need to do things to help with inflammation too. And again, there might be another factor triggering inflammation, but sometimes you just have to kind of break that inflammatory cycle. Whether it's with high doses of like fish oils or turmeric, or make sure you have healthy vitamin D levels. But it's, I guess it's a lot more complex than just eating well. In some cases, some people, all they'll do is clean up their diet, and that's all they need to do. But some people, they need to dig a little bit deeper.
That's a really good point. Yeah, if you've been in insulin resistance for a long time, just just having better habits isn't necessarily going to fix that, because the communication is so off between the cells and the pancreas. So yeah, I often will see like a 30-day kind of reset recommended, where you're really strict and probably doing, like you said, some high dose supplements for a while just to reset those cells. So that's a great
Mhm.
point. That's a great
Yeah, and
point.
sleep also. I mean, sleep, people don't think about sleep and blood sugar, but you need to be getting adequate sleep to have healthy blood sugar as well. And, as healthy cortisol, healthy adrenals, which insulin and cortisol kind of go hand in hand. So yeah, I mean, if you're eating well for that 30 days that you mentioned, but if you're only getting 5 hours of sleep, that's also that, I mean, you got to factor everything. And you're right, you do need to be strict. You need to be strict with the diet, the sleep, the stress management. And as you mentioned, supplementation usually is important as well.
Yeah, those are good tips. Okay, the last question I want to ask you, I don't think is in your book, but I might not have gotten there yet.
Okay.
Uh, I wanted to ask you. I mean, I'm listening to Dr. Jack Cruz recently, and he was really stressing like the blue light hitting our thyroid. He thinks is a big problem. So, and he's big in the EMF space. So, just wondering, your opinion on that. I know you're a big researcher. Do you think there's enough any research? Is there enough research? What are you observing?
I do talk about blue light. I
Okay.
don't spend a lot of time in the book on blue light, but I do talk a little bit about blue light, and I do talk about electronic pollution. And without question, I think we need to minimize our exposure. But as far as, the research, um, not so much thyroid. I mean, I didn't come across a lot where, it's affecting thyroid, or really a factor in autoimmunity. It doesn't mean that it's not a potential trigger, but I think it's more of just a contributing factor. And then it also could affect, for example, there is some evidence with it affecting melatonin production. So if it affects melatonin production, and that affects our sleep, and that affects blood sugar we were just talking about. So the lack of sleep could, that could, predispose you to autoimmunity. It's not a trigger, but you know, again, make you more susceptible. So yeah, I do talk about electronic pollution and blue light,
Okay.
not a whole lot,
Not
but
in
yeah,
depth.
of course, definitely want to try to minimize your exposure as much as you can.
Yeah, I know melatonin, besides sleep, it does a bunch of stuff in the body, right? It's an antioxidant and
Yeah,
contributes to
important for
blood
gut
sugar.
health. Yeah.
Yeah, lots of processes, so that's important. So I just want to finish up with just saying how people can get the book. Well, mostly said it's on Amazon, and it's called Hashimoto's Triggers. The name is Eric Osansky, and your site is naturalendocrinesolutions.com. Is that right?
Yep, you got it.
Oh, you know what? There's one other thing I forgot to ask you. Can I get one more question in?
Oh, sure.
Okay. That is about essential oils, because I'm starting to do a lot more essential oils. I'm actually starting to prepare a thing on essential oils and thyroid. And you have a really well like researched, or like, what's the word? It's like, well, on the Google ranks high up there. Your
Okay.
articles on essential oils and thyroid. So I've referenced them before. I saw you wrote a new one recently. I'm sure it's just like an adjunct. I'm sure it's not like the center of your practice or anything, but I'm wondering if you've gotten a lot of comments and questions on essential oils, and if you have any stories on people feeling like they were useful to them, or just anything you found.
Yeah, a lot. I mean, the reason why I've written those articles, honestly, it's not because for years I've been using essential oils, but there's just been a huge interest. So I just felt like I needed to dive into the research and especially like frankincense, myrrh oil. I mean, there's a lot in the research about helping with the immune system and inflammation. And yeah, I've had a number of people, not all patients, but I've had some patients, but also just a lot of people, commenting and just I wrote. I think I wrote. I'm trying to think now. I wrote every now and then. I'll write a blog post asking what people's experiences with, different. And I'm pretty sure I wrote one. What's your experience with essential oils not too long ago? And overall, the experience. That's one area where you very rarely get anything negative. I wrote one like, what's your experience with iodine? And there was a lot of negative, and there was some positive, but with essential oils, it's almost all positive, and a lot of people are definitely into essential oils. But yeah, that's the thing. A lot of people, or some people, don't realize that there is research out there on essential oils. And so when I started hearing about the benefits, I didn't realize how much research there was until I dove into PubMed and was looking at the studies. And, don't get me wrong, there probably needs to be more. That's with anything natural, whether it's herbs or essential oils. But, the research studies that are out there are quite promising. So yeah, I would agree. You mentioned kind of a couple of minutes ago that or you suggested that just essential oils alone probably is not enough to just get someone in remission, but as an adjunct, just in combination with other things, making sure you, as we just mentioned, getting eating well, getting enough sleep, and having healthy vitamin D and other nutrient levels. But yeah, I'm definitely becoming a much bigger proponent of essential oils, and looking to dive even more into the research.
Awesome. That's so great. Yeah.
Yeah,
And I want to just say I get a lot of questions about it too because I'm starting to offer them more in my practice. And people are like, well, what about thyroid? And I would just say, it's not like there's, oh, this is the one oil you take to heal your thyroid. It's not quite that simple. Um, but there are so many ways that essential oils can benefit, like you said, your immune system, inflammation,
yeah,
digestion. So I think there's a lot of uses because thyroid is such a multi-symptom complaint, and like there's so many triggers, so we can go after a lot of those triggers and symptoms with essential oils. But it's, and I would also say you have to use them like medicine to get them. You can't just, oh, I put on that oil last Sunday. It's not enough to get
yeah,
a therapeutic effect. But there is, like, I agree, there's a ton of potential. And I just really I love something that's not a pill, because everyone gets tired of taking too many pills. It's just not, I think it's against our human nature to want to take a lot of
yeah. No, I
pills.
agree. And what myrrh and frankincense, there are some people that rub it on the thyroid as well. So again, you want to be cautious about applying the essential oils to the skin, and use the carrier oils and all that. But there are, and I'll say there's mixed results, but that's probably with anything. There are people even that eliminate gluten and they don't necessarily feel better when eliminating gluten, but that's because there could be other factors. So same thing, there are people who will, rub some myrrh oil and frankincense on the thyroid, and they might claim that it's done wonders, and then someone else will do the same thing and they feel like it's not helping. But I think it comes down to biochemical individuality. Everyone's different. But then also there could be multiple triggers too, and so there,
Definitely. Yeah.
yeah, multiple imbalances, I should say, as well. So
Yeah, you definitely. I mean, I also think it's our human nature to want a quick fix, even if we respect natural medicine and all. Like,
hmm
we just want something to be the thing.
true. Yep.
And sometimes, like you said, sometimes it will be for one person. But yeah, if you're doing essential oils, but you haven't addressed your stress or some other element,
Exactly. Yep.
it's still going to be hanging out. Well, thank you. I appreciate you adding that on. And again, the book is Hashimoto's Triggers by Eric Osansky, available on Amazon. And Eric's site, which is fantastic, there's tons of blogs and information, is naturalendocrinesolutions.com. And do you see patients online, Eric?
Yep. I
Okay.
do. perform phone and Skype consultations.
Okay,
Yep.
awesome. Well, thanks for your time, and we'll see you next time.
All right, sounds good. Thanks for having me again, Bridget.
Bye.
Okay.